So Ijeoma, what were the events in your life that caused you to want to go into medicine? When did it hit you that you wanted to be a doctor?
Well, it actually wasn't that long of a thought process because my dad is a physician, retired physician now. He trained as a nephrologist, and my mother was a nurse. So I've always been sort of involved or introduced to the healthcare field. And I knew I was going to be a physician when I was probably in grade school. I wanted to at that point, yeah. But certainly by the time I was in high school, I knew for sure I was going to be a physician. And my parents nurtured that. That was the great thing. They encouraged that. And actually, I knew I was going to be a cardiologist, or certainly had that interest when I was in college, because I worked in a telemetry unit. And funny story is I saw a physician in the hospital, and I told him I wanted to go into cardiology. And he said, well, why don't you do something else? That really isn't for women. So funny as we talk about being mentors, that had I listened to that, I would have never actually come into this field. And thankfully and hopefully those messages are not being shared with women who are interested in cardiology. But when I was in college, I majored in sociology. It was a dual major in sociology and biology, and I knew I wanted to impact individuals on a much larger scale. Thankfully, I realized there was such a thing as preventative cardiology. How can we use lifestyle changes, whether you're exercising, eating healthy, losing weight, to prevent or even reverse diabetes, high blood pressure, high cholesterol? If we can get everybody to think from a prevention perspective, I think that we could really make a difference when it comes to healthcare outcomes and people developing chronic diseases. There definitely is a big focus on treating disease once it's already there, but I think we need to get more people to buy into prevention.
You may be a pioneer in this area of social determinants of health before we even had that phrase.
Yeah.
Because when I think back to pre-med, I wasn't aware of the impact of these social determinants, and you were already thinking about that and focused on that.
Yeah.
And now that's such a hot topic, and as we peeled the layers of healthcare away, we realize it's not just can you take the pill, it's can you get to the appointment,
That's right.
Can you get the test, can you afford the pill,
That's right.
Do you have access to go back for the follow-up? So many layers to, do you have childcare so you can come to your appointment?
That's right.
Do you have a car that works? Things that we've just never thought of.
I think what really broke open the doors was the pandemic. That's when we got to see that there were certain populations, people who lived in rural areas who couldn't get health care, minorities who couldn't get health, or people who didn't have health insurance who couldn't get health care. Your everyday individual became aware that, wow, there are more things that impact my ability to get health care, get to a hospital, get tested, right? Even when COVID testing was around, get treated, than just whether or not I can take the medication or have the medication. And I'm happy now that there's a bigger focus on social determinants of health, because I think that is sort of righting the ship to focus more on all the other factors that impact healthcare outcomes, and hopefully can result in some change. So Gina, how did you get into medicine, and specifically, how did you get into cardiology?
I knew early on I was good at math and science, and my father always encouraged that. And I was a double major in psychology and biology. And my greatest dream, my aspiration, was to work at the Atlanta Zoo.
Oh, okay.
Yeah, I wasn't a vet. I was just going to work at the zoo. And after my freshman year at University of Georgia, thank God for the guidance counselors there, because I got a phone call that the pre-med advisor wanted to meet with me. And I thought, what in the world could that be about? And he was the first person that had ever told me in my whole life, I think you could be a doctor. And that was such a far and crazy idea. And so he encouraged me to get a summer internship at a hospital, which happened to be Emory Decatur Hospital, what we used to
Talk
call
about full circle.
Yeah, what we used to call DeKalb General. And they put me on the cardiology floor. This is like 1986, so we didn't really have angioplasty. People were still in bed for days and days, and we had lidocaine drips, the dark ages of cardiology. But I really was inspired. First generation doctor, first generation college grad. And during my fellowship, I was leaning more toward critical care cardiology and intervention, but I felt like, gosh, we're just, doing a stent and sending people home, and the damage is there, and we're just sort of patching them up. And I got interested in preventive cardiology as a way to get ahead of it. As I got into private practice, I saw these women patients who were, late in the diagnosis, sometimes full-blown heart failure or extensive coronary disease, and they had basically been dismissed. And many of them had been complaining of chest pain for years. You're either patted on the head and told it's stress and go home and take a bubble bath and here's your Xanax, or you're just dismissed like, oh, that's not your heart, you're fine. And instead of treadmills and echoes and nuclear stress testing and heart cath being recommended, they weren't. And so this was the late 90s, and in 1998, I started the first women's heart program in the state of Georgia in a large private practice group. And I remember at the time the other cardiologists saying, like, you're gonna take care of all that fluky chest pain, the palpitations, the dizzy spells. And I was like, yeah, send them on. I'll take care of all of those women. You just send them and I'll take care of them.